Welcome everybody with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology and gastroenterology. Our topic today about new strain of HIV has been discovered in Netherlands. The strain dubbed the VB variant appears to lead to more severe disease more quickly. People with this strain also tended to have higher viral loads. So, new research from the University of Oxford finds a new variant of HIV that is potentially more infectious and could more seriously affect the immune system. So far, 109 people, most of whom live in the Netherlands, have the variant. So, as regards the new HIV variant causes illness twice as fast. The new strain called the VB variant damage the immune system, weakening the ability to manage everyday infections and the disease much faster than the previous HIV strains. It also means that people who contract the new variant could develop AIDS faster. Researchers also found that VB has a viral load about 3.5 to 5.5 times higher than the current strain, indicating that it could also be more infectious. As regards the immune system, damage occurred twice as fast. Researchers say CD4 T cells decline, a sign of immune damage by HIV, was twice as fast in people with the variant. By the time they were diagnosed, these individuals were vulnerable to developing AIDS within 2 to 3 years. Unless using treatment, critically low CD4 cells counts with long-term clinical consequences is expected to happen 9 months after diagnosis on average for people in their disease with variant VP variant. The VP variant ability to facilitate transmission damage the immune system and interrupt treatment is a reminder of how smart the virus is evolving over time. So, testing an important tool against HIV. When asked what the variant means regarding testing recommendation for those at risk, the expert said it depends on people behavior. And as regard this variant, it depends on your activity and how many different partners you have. He said, some experts said, adding that people who have multiple partners should undergo HIV testing more often. Also, FDA said that VB is a cause for alarm. I think it's a cause for renewed focus. And they said we have been able to move HIV AIDS from a deadly disease to a chronic one. The battle against viruses is never-ending one. So we should focus on prophylactic care. Also, some experts said that the disease is risky for the people who have multiple sexual partners. As regards testing and the current treatments, will still control the disease. So, as regards the treatment, is the same for all mutant and subvariant of HIV. The problem is that variant is rapidly control on the CD4 cells and decreases the number of it rapidly, and this leads to more complications rapidly. So, as regards the amount of virus measured in drop of blood is a surrogate of disease progression. The higher the amount, the more likely someone will progress and become ill. We suspect many times this is because type of HIV they got was more aggressive or virulent. So our practice is the same regardless of variant. Get tested right way and start treatment. Also, there is no evidence that the current treatment would not work. So, it is very important to diagnose cases of HIV rapidly and to give the patient the proper treatment rapidly. So, if we know your status of HIV and those you have sex with by getting tested first, use condoms for sex, don't share any needles between the persons, especially the addicted persons. All this will prevent from spread HIV or the variants of HIV. Also, we can use pre-exposure prophylaxis in some occasions. As regards the treatment for people living with HIV, so there are medication, tenofovir, imitricitabine combination tablet daily, and also cabotegravir injection every 2 months. As regards those individuals that have HIV take their medications, we find that the virus undetectable on their viral load, which eliminates the chance of HIV transmission. So, it is very important to spread health education about the importance of treatment, especially early treatment and early diagnosis of the disease. So, it is as regards this variant, as I told you, it is spread and and also can control CD4 rapidly more than the classic HIV virus. Thank you very much.